So what I've actually put together today is to basically look at One Health and what we see as some of the either current, existing, or emerging challenges in the West Africa sub-region and as an extension in Africa, because I now do extensive work with Africa CDC across the continent. And and my thing is to offer some insight and also to provide some perspectives based on some of the research that we are currently doing in Sierra Leone and in also collaboration with other countries. So if we um, look at currently the West Africa landscape, and it is a very complex, probably one of the most complex regions of Africa, both in terms of biomes, environment, in terms of human diversity, and also diversity of animals. So West Africa in itself presents itself as a perfect environment for a One Health understanding. There is a lot of cross-border mobility. Currently, as I'm presenting, I'm seated in Mali, in West Africa, which is maybe 2 countries removed from Sierra Leone. And the way I got here was basically driving to Guinea and then taking a flight from Guinea to Mali, which means that in a short amount of time, I'm able to contact as many people. And then also, if I was carrying any infectious disease pathogen, that means that I will still be within the window of incubation to be able to move between these countries and then get back to Sierra Leone and then and all that. But there is the similarities in cultures at the borders. So yeah, so if you took look at Sierra Leone, Guinea, Liberia, up to Senegal, Mali, you have the same ethnic groups, same groups moving back and forth between the borders. And so the borders are very fluid. So the cross-border mobility is very high, both for humans and for animals as well. We share the same animals, the same packs that run in Sierra Leone, run into Guinea, run into Liberia. So we share and the animals move within this also. The surveillance systems, of course, is challenged as in any part of the world. Surveillance is always challenged, but we have it even challenged because limited ability to for rapid detection, timely detection, sometimes from our weak diagnostic systems or lab infrastructure systems, but also active surveillance at some of these point of entry or even at the community level, which also challenges creates a lot of challenge. Workforce shortages is a challenge for many of us. And then, of course, coordination is a major challenge within the region. So if you take out West Africa, it's really present itself as a perfect environment for One Health. And so built around this whole concept is also the challenges with the environment, and when you go into wash, water, sanitation, and hygiene still poses a major problem in the region. So it challenges our IPC, and IPC is the bedrock of a lot of the infections that are the outbreaks and epidemics that are happening. In fact, when you go back to the history of Ebola outbreaks in West Africa or in Africa in general, if you go back, you find out all the time that the outbreak happens when it hits the hospital or the health facility. And the major part of it is IPC challenge, because then it gets to the hospital, there is a challenge with IPC. So when you look at even the Marburg outbreak that just happened in Rwanda, the same thing in DR Congo, successive Ebola outbreaks are actually linked to some IPC challenges. So water, sanitation, and hygiene becomes really important. And currently, I will talk about that later. We have even a project right now we are looking at with wastewater. Wastewater surveillance, but also linked to things like mpox. Looking at and things like reverse zoonosis. So zoonosis coming from shedding, people shedding back, infected people or people who have become survivors shedding virus back into the waste, to the wastewater systems, and people probably getting reinfected, or animals in that environment getting reinfected with pathogens. Of course, deforestation and urbanization. West Africa, many parts of Africa, we are rapidly urbanizing. Africa probably is the highest rate of urbanization is happening within the African continent. And that in itself is creating a lot of challenges because we are actually then breaching the buffers between human, animal, and environment, and creating opportunities for spillover events. This is becoming more and more frequent. Of course, on the ecological side, issues around vectors through irrigation is an issue. So this is more of an issue for things like dengue, arboviruses, Zika, chikungunya, a lot of other pathogens that can be passed through. And of course, there's a lot of sensitivity here also between these pathogens and also the viruses, the vectors and the pathogens that they carry as well, because they are all linked to the next important thing, which is climate change. Also, they are all very sensitive to climate. Mining is one of our major problem, and we have a project looking at currently at looking at from a One Health perspective, the impact of illegal mining and mining overall on human, animal, and environmental health. So looking at all the dynamics around you. So currently we're seeing, for instance, in the current outbreak, the recent outbreak of Marburg in Rwanda, it was linked to mining. A miner actually passed it on to his wife, and the wife, unfortunately passed away, and that's how that was the index creating the huge Marburg outbreak. The outbreak of Marburg in Ghana is also linked to a miner mining activities. So there is definitely this sort of connections, and that is out of the whole impact of mining on water systems, on soil systems, heavy metal toxicity of communities. Currently in Sierra Leone, there is a huge issue, a huge public health issue, huge issue around contamination of rivers and water sources from heavy metal toxicity. So that causes a lot of challenges, both from impacts on animals, sensitive animals and indicator species, but also impact on humans within that ecosystem. So understanding it from a One Health perspective becomes really important. And it's a work we're hoping to get started with in Sierra Leone, and then try to build it with more linking epidemiology, human and animal health, but also doing some environmental toxicology to understanding the levels of contaminants in water and soil. Climate change, obviously, it's a big issue, and West Africa, like in most part of the world, is impacted a lot. Currently, I'm in Mali here, where the temperatures right now is over 41 degrees. So it's really, really hot, and people here are complaining about how hot it has been, and so we're seeing extreme weather events, and which has a lot of impacts on both human and animal health, and of course impact on very on things like vector populations, changes in these vector populations, the movement, their geographic area where they are. Some are moving much more further than where they used to be, creating more problems. And so there's a lot of things happening. And in West Africa, actually, the challenge is also the capacity to do this, to be able to get very good predictive modeling, also getting a lot of the climate data so that that can also be linked to some of these effects. So if we look at things like malaria, becoming more and more cases of malaria in the region. So that we are tracking with some of our studies, and I'll show that later. Rift Valley fever is expanding its range, of course, trypanosomiasis, and of course, there are issues with in areas around Mali, Niger, and other countries having connections between the Harmattan winds and meningitis spread, which is also of importance. But importantly, what is critical with the climate change and health impact is the frequency we see these days with viral hemorrhagic fevers, things like also Lassa fevers, arboviruses, expanding their range, and of course, other infectious disease pathogens. And of course, we see impacts on food systems, impacts on water quality, impacts on biodiversity, and most importantly, in Sierra Leone, we have some few studies that we are trying to put together on understanding the impacts on mental health because we get a lot of flooding. We get a lot of seasonal flooding here, and also a lot of issues around extreme weather events that are happening. And due to climate change, direct link with climate change. In 2017, we had one of the biggest landslides in West Africa, which killed over maybe 2,000 people and more unaccounted for. But that happened with rain that fell in between August 14 to August 17 of 2017. We had rain in 3 days, about 2,000 cubic meters of rain, which is somehow amounts to about rain you get in about 3 years. And so that created a huge issue with that landslide. And then, of course, now we are seeing a lot of rain have spread all across the 12 months of the year. And so that in itself is impacting the calendar year for farmers and also impacting on food production. And of course, when you impact food production, you are also having, links to people then having to shift towards, wildlife and other food things. So, and then creating more opportunities for contacts with VHFs. So, so there is a lot currently in this area, and we've done a lot of work both with the West African Health Organization, Africa CDC, and WHO to map out priority zoonotic diseases. So we have the viral hemorrhagic fevers. Anthrax remains a threat because we do get these days a lot of outbreak, and then also the frequency of these outbreaks are increasing, and that is definitely something that is more linked to climate effects. And of course, when you look at Lassa fever, for instance, we generally in Sierra Leone, Nigeria, Guinea, Liberia considered the endemic areas of Lassa fever. But this belt is expanding. Now we know Lassa fever is in Mali, is in many parts of the region. So it's expanding as these rodents that are associated with Lassa fever are also moving. Climate is changing. So the geographic range of these pathogens are also increasing, which creates a huge burden for the region in terms of disease burden. It adds to, the malaria and other things. And so we know, of course, now Mpox that used to be a very small or tiny or relatively obscure, neglected tropical disease. All of a sudden, Mpox has become almost a disease, an epidemic of international concern. It spread globally, but across the continent. So Sierra Leone just experienced the highest Mpox of the Clade 2B strain outbreak in Sierra Leone, which was probably the largest outbreak in Africa next to DR Congo with the Clade 1A and 1B. So we are seeing things that before were not considered threats, and now they've become more and more. And Marburg is showing up a lot across the continent. We've seen Marburg in Tanzania, Marburg in Rwanda, Marburg in Ghana, and Marburg in Equatorial Guinea. And Uganda, so it's coming up, and this was not the case, and it's the frequency is getting shorter and shorter. So these are all issues that are becoming huge threats for a region that is already plagued with additional either endemicity, or they have issues with the health system challenges, which I'll talk about later. So these are some of the work we've done. We keep following on Ebola survivors in Sierra Leone. Sierra Leone had one of the worst case of Ebola outbreaks in the world, Sierra Leone, Liberia, and Guinea in 2014. And we've been following up on Ebola survivors since 2014. So I just did a 10-year sero survey of Ebola survivors to look for B cell memory on them if they still retain. And we've actually been working a lot. I think probably our group in Sierra Leone is probably the longest group who's been involved on Ebola, with our colleagues at University of Wisconsin in Madison and University of Tokyo in Japan. And so we've gotten a lot of work done on vaccine development, and then for surveillance of novel acute viral hemorrhagic fevers. And then, of course, looking at the epidemiology, and some of my team is now also working a lot on the anthropological aspect of things. And of course, okay, I've just spoken about this. I'll just shift to the next slide. So currently we have with the West African Consortium, we are part of a consortium for which I'm the principal investigator in Sierra Leone, along with colleagues from Guinea, Mali, and Ivory Coast, and Liberia. So this group came together after Ebola, and we continued to work on Ebola, but other epidemic pathogens. So currently, we are working on a big project for which we just launched this week in Mali, which is strengthening clinical and genomic research capacity on arboviruses. Arboviruses are becoming the next frontier of threats in the sub-region, the dengues, Zika, chikungunya, of course, as an extension, Rift Valley fever, and others, flaviviruses. Again, they are very climate sensitive, the pathogens themselves, but also the vectors. So, and we see in all of the countries outbreaks. There has been over 29 outbreaks of dengue in West Africa. That's something we recorded in 2023. And so we are seeing more and more, and many of them are going undiagnosed, and also on without much notification in by national governments in some of these countries. And so a lot of them get under masked by the malaria. They become just fevers of unknown origin or acute febrile illnesses because of the high burden of malaria, high burden of Lassa fever. You end up not, people end up either dying or misdiagnosed, and not, so some of these are not, they don't come onto the radar. So I think this project becomes one of a big project where we are intentionally and deliberately trying to do work on expanding the surveillance, both for symptomatic arboviruses, but also the asymptomatic in the population. So we can actually have a better understanding of prevalence, but also we can understand, the movement between asymptomatic to symptomatic, and understand more around the vectors also. So that's sort of our work. And my team also has been doing quite a bit on identification of zoonotic and other novel viruses in Sierra Leone. So this is work that is ongoing through some metagenomics work and other forms of surveillance. And we do a lot of bat works with bats in different parts of the country, looking at virus discovery, but also focus on also looking both at the humans also. And so this is a very interesting project that came up, which I'm still trying to get going on with my team, is actually looking at the possibility of reverse zoonosis. from sick people or recovered people from mpox, the possibility of reverse zoonosis happening to animals. So normally we know that mpox sort of gets this zoonotic thing from human animals to humans, but we seldomly talk about the possibilities of reverse zoonosis in crowded spaces, in areas where you have a lot of survivors and people shedding back into wastewater. And then we live in our regions here with a lot of animals, rodents, lizards, a lot of other stuff around. And so not much has been done around the possibility of this reverse shedding happening and then potentially creating new reservoirs or new systems for infection. So those are all possibilities we are looking into. So I would go on to the aspect of indigenous knowledge, which is very near and dear to my heart when I do work on One Health or work in with communities. And I understand that often this is the biggest challenge because we even talk about it as integrating, traditional knowledge or wisdom into modern. But when we say integrating, we actually even saying that it is of a lesser knowledge and it needs to be integrated into this other knowledge that is a more dominant knowledge. And I think I even, often don't, do I even use it here, but I often don't like to use the word integrating. I almost feel like it is knowledge of its own that has to be held at the highest level by itself and then evaluated based comparatively with other knowledge systems. And I think when I've worked on Ebola in Sierra Leone, I have actually learned a lot. I learned a lot. I led a USAID project on stop spillover to a community in Sierra Leone, and we were doing a bushmeat study. And I mean, interestingly, I went there with a lot of focus group, qualitative studies, quantitative, setting up all the social behavioral studies. But eventually, actually, I did learn more. I learned more from the communities. And that's when I really understood that we evaluate their knowledge systems based on a Western standard knowledge systems, and that cannot work in these systems. We really have to be able to decolonize our knowledge base and then allow for co-creation of knowledge. And that co-creation of knowledge becomes really important. And so currently, I've been actively involved in how do we co-create knowledge around community-based surveillance and One Health for communities, and how do we really understand, not coming from a point of view of our own biomedical or public health interventions for understanding, but understanding the indigenous knowledge in itself, and understanding how they have approached the environment, how they've approached animals, how they've approached human health around them, and the way we look at human health, and it becomes really important, and because that's the key that informs a lot of our interventions. So they are not just packaged interventions or going in to disrupt exactly how they have existed with. So when I talked about even One Health, I say One Health is just part of what these communities are. When I went to these rural communities, they're actually already doing the One Health has been part of their nomenclature. One Health has been part of how they coexisted with the environment, with the animals, with the communities. The buildings that they have, the grass huts, are all based around the first principles of, environmental conservation, around, minimizing our carbon footprint and all of that. And so there's a lot of knowledge that is often lost because we almost go on with this sort of very dominant knowledge systems, and oftentimes it has a different implications. So how do we integrate traditional healers? Or how do we work with traditional healers to understand their own knowledge systems around healing, around spirituality, around animals, around plants? And because it becomes an important principle when it comes to biodiversity conservation, when it comes to many other stuff around One Health. Farmers, how do we work with them? Traditional farmers to understand their knowledge-based systems. And one of the things we're trying to encourage in Sierra Leone is actually how do we bring these people to the classroom on a level, on a level playing field, as we can actually call them professors and things that because they have a knowledge that oftentimes we feel like the knowledge that they have is not high or minority knowledge or marginal knowledge as against a more dominant knowledge system. How do we bring them? How do we bring naturalists in communities who understand about conservation, understand um, um, about nature, about things, because that becomes important when we truly, if we truly want to push One Health forward in various communities. And so, I talked about it here, and I looked at a model in Ghana that actually is a success story in terms of, integrating traditional medicine into the national healthcare system. But again, this is the important part that it always talks about integration, right? And that's the challenge because we even in West Africa, when you look at the healthcare professional, the average healthcare professional is educated in a school system that is colonial, and so that colonial education that we've had for long years has always been about looking at um, your own knowledge systems has been inferior, and then whatever comes from outside has been more superior. So basically, then the healthcare professional in West Africa in himself, has to decolonize his own knowledge about his own environment, so that he is more of accepting about the fact that there is knowledge in his own community. So we have to kind of really revisit all of this. And it became very handy very when we worked on a documentary called Tama with a colleague anthropologist at London School of Tropical Hygiene and Medicine. And it was a brilliant documentary that looked at the role of these traditional healers in emergency outbreaks like Ebola, how they actually did very, very successful interventions during our Ebola outbreak, used medicines, used therapies, used stuff. But because again, we operate in a systems of where that knowledge is not considered good knowledge, those interventions were not considered formal interventions, then they were put under the rug. They were not brought forward. And even oftentimes what we talk about is about banning traditional healers or they are actually barriers to our intervention. So basically, I think that has to change if we really want One Health to move forward. And then, here is just like and sorry, actually, I was putting together slides, so I didn't edit some things, but so the project for there is a misnomer. But truly, as I look through what I build in Sierra Leone with my team, it's really from an infectious disease perspective, it's really looking at the multidisciplinarity, the interdisciplinarity, and even transdisciplinarity that exists between an infectious disease, environmental systems, impacts on animals, and animals going back again. It's a two-way thing. Our political economy. I have a colleague who has been working with me. We actually looked at even the Ebola outbreak in Sierra Leone, how it actually was a precipitating event that led to a change of government in Sierra Leone. So the previous government lost, simply because of how they've handled some of the Ebola outbreak. But then the nexus with indigenous and also anthropological aspects. So those are things that we routinely do, and I'm happy to collaborate with people. And then, of course, As I wrap up here, I'll talk about the framework of One Health. And of course, there are lots of challenges, lot of strength. Countries are building One Health platforms, moving towards One Health in the region in Africa. But there are still challenges, the workforce challenges. Again, as I talked about, again, even within that available workforce, we need to decolonize the minds of workforces. Weak national coordination is still a challenge because people still operate in silos. Human health operate in human health. Animal still wants to hold on to animal health, and then environment, then limited opportunities for even systems interoperability between the two. So again, there is not much focus to from operational research because sometimes country government are not, putting up a lot of funding onto operational research. And of course, there is a lot of issues on funding gaps, which goes with that as well. And of course, um, sorry, yeah, let me do this. Yeah. So, and of course, yeah, there is, of course, still challenges between surveillance and information systems, which, I've talked about some of that in just now. And then, so when we look at the research landscape, preparedness, still we have limited prioritization for One Health research, but also, in fact, for research in general within in the sub-region. And the insufficient, of course, research capacity, and then a lot of other things like regulatory systems. Funding becomes the biggest challenge because a lot of the funding happening in West Africa is coming sometimes from external sources, which then creates issues around prioritization. How do you prioritize the research? Which areas are you prioritizing? Whose priority are you working on? So oftentimes local priorities suffer as against priorities that come from outside, and so that's it's a major challenge. And so, as we try now, we're working a lot across with Africa CDC, Africa Centers for Disease Control and Prevention, West African Health Organization, and many others to kind of begin to change and build a stronger one research capacity, One Health initiatives, and then and building the next generation. So, in terms of capacity building, I will think more around how do we prioritize national agendas, which we have been doing. I supported the government of Sierra Leone through the National Public Health Agency to develop our One Health research national agenda, but also how do we strengthen more coordination mechanisms, and then building a core competent workforce within the region from a human, animal, and environmental sectors that also understand the interdependencies and interconnectedness, but also can operate within the ethical landscape around this, because it's not just to understand it, but also to understand the ethics around One Health and ethics around our interdependencies, and also understanding that there is a moral duty for us to, for instance, to preserve animals, to preserve the environment, and having that in mind, but also this capacity also to build in the indigenous knowledge systems and create a more formal recognition, documentation of indigenous knowledge, and co-referral mechanisms. And above all, really, how do we harmonize the data systems and creating more One Health indicators, interoperable system. This is one thing I had gotten an initial grant with the Gates Foundation to kind of work on systems interoperability in Sierra Leone. How do we begin to create the environment, animals and humans to talk to each other, that data? And that's still the big challenge, because, and then it really impacts our ability to prepare and respond to pathogens, because currently you look at the environment is operating in its own fragmented way, and not much talk between even the layers of climate change. How do we model that? How do we create more predictive modeling and understand how it impacts, how it's impacting animals, how it's impacting humans, and all those kind of things. And of course, the legal frameworks around things.